During last week's City Council meeting at Barrie City Hall, three presentations were made. The first presentation was by the Simcoe Muskoka District Health Unit, focusing on public health in the region. The second presentation discussed update on the affordable housing strategy, while the third presentation discussed the homeless prevention strategy by the County of Simcoe. Medical Officer of Health Charles Gardner explained that the key responsibilities of the health unit include guiding disease prevention and promoting health. These responsibilities span from ensuring safe drinking water and facilitating vaccinations to managing emergency preparedness and reproductive health initiatives. Gardner pointed out that despite the severe impact of the recent pandemic, leading to over 700 deaths in Simcoe, Muskoka, the potential mortality rate was significantly reduced. This was achieved through diligent surveillance and the administration of over 1.5 million vaccine doses. These efforts were also recognized with a commendation from First Nations Primary Care Services. Gardner also touched on the opioid crisis that worsened during the pandemic due to disrupted services, leading to an increase in mortality rates. He revealed that the health unit's funding comes from both provincial sources and obligated municipalities like Barrie, expressing some uncertainty about future provincial financial support. Finally, Gardner urged the council members to bear in mind the profound impact of their decisions on population health with an emphasis on those most vulnerable. The second presentation discussed the affordable housing strategy, which is structured in three stages. The first stage is currently nearing its conclusion, which comprises a thorough housing needs assessment, scrutinizing the prevailing market conditions and pinpointing the housing gaps. The data presented indicates a clear discrepancy between supply and demand in housing. Over the previous decade, the standard price for resale homes in Barrie surged by 170%, while income saw a growth of only around 34%. In spite of a recent drop in housing prices attributed to adjusted interest rates, the issue of housing affordability remains unsolved. Meanwhile, rental rates in Barrie are increasing rapidly, with many options now exceeding $2,000 a month, which is only considered affordable for households earning $80,000 or more per year. Looking ahead, the second phase will focus on creating strategies to address the affordable housing crisis in Barrie, drawing from successful and unsuccessful lessons from elsewhere. The final phase will involve updating the formal affordable housing strategy document for final approval by the City Council. Mina Fayez Bagat, the General Manager of Social and Community Services for County of Simcoe, presented homelessness prevention strategy. He said a threefold development in the past year has led to a 10-point strategy to address homelessness. Firstly, a shelter system review was conducted to better understand the needs of the current system. Secondly, significant increases in funding were received from both provincial and federal sources. The provincial funding increased by 86% to $9.2 million, a year after a federal funding was increased from $700,000 to $3.6 million. Lastly, a public-facing data strategy is being developed to inform future investment decisions. The two primary goals of the 10-point plan are to end chronic homelessness and to prevent homelessness by lowering the number of people at risk. Measures will be taken to make affordable housing more attainable, create supportive housing programs, and utilize existing housing stock more effectively. The county is also enhancing eviction prevention services, offering increased funds to individuals and families at risk of eviction. It is also improving the shelter services system by offering grants for immediate repairs and accessibility improvements. Additionally, it is investing in new opportunities to create more affordable housing. To access specific presentations, you can utilize the timestamps provided in the descriptions.
There are three presentations taking place this evening, the first of which is from the Simcoe Muskoka District Health Unit concerning public health in Simcoe, Muskoka. I'd like to call upon Scott Ward, Board Vice Chair, and Charles Gardner, Medical Officer of Health, to the podium to provide the presentation this evening. Gentlemen, you have 10 minutes. I'm told to remind you, that's what my notes tell me. And if you're running close, I'll give you a heads up and go from there.
Thank you, Your Worship, members of council. I am quite familiar with the 10-minute limit, trust me. Before we begin, I just want to thank the City of Barrie for the support of the Simcoe Muskoka District Health Unit over the years. I've had the opportunity to serve on the board for 15 years, 10 of those when I was a member of Simcoe County Council, and then most recently as a public member. It's great to see Councillor Morales again after all these years, and to finally see Councillor Harvey in person. And of course, we have two wonderful representatives, including our chair, Anne-Marie Kungle, Councillor Kungle, and Councillor Nassisi. Great to see you in person for the first time. That being said, I will now turn things over to Dr. Gardner for, I think, what you'll find is a very informative and interesting presentation.
Thank you, Your Worship and members of council. This is a great opportunity for us to be able to engage with this council as we are with our other councils, given the newness of, even though it's been a while now, newness of the councils and the newness of our board as well. So basically, this is an overview of public health services in Simcoe County and the District of Muskoka, or really in Barrie, and what they're all about. I was told this would lag. There we go. So public health is all about the prevention of disease for the population as a whole, and the vision in the board's strategic plan is healthy people, healthy places, with a mission in which, with our communities, we prevent disease and injury and promote and protect health for all in Simcoe, Muskoka. So at this point in time, we have 15 Board of Health members. The Board of Health is our governance body, as our board vice chair, Scott Warnock, had indicated. Councillor Kungle is our board chair. And we have also Councillor Nagosi is member of the Board of Health, and we have two other members in council today who have been former members of the board. So public health is about preventing disease, working with the population as a whole, but that plays out in many, many ways. It really takes you to the determinants of health. And all of that is codified within provincial legislation, the Health Protection and Promotion Act, that enables the existence of boards of health and health units, and is supported by the Ontario Public Health Standards, which dictates the programs that we are to provide to prevent disease in the population as a whole. And it plays out with regards to a lot of things that we would do with municipalities. And I would say that municipalities are the driver behind one of the two most important things we've ever done as a species to improve our health, and that's safe drinking water. The other major thing is vaccination. So we have a foot in what municipalities do, and we have a foot in what healthcare does. And then, of course, there are many, many other things that we do as well. And, community emergency preparedness and response would be another area that we share with municipalities. And if you think about adverse weather events, or at this point in time, air quality is an issue, that can impact on municipalities. Certainly you can get crises that affect municipalities. You can have flooding or tornadoes, which have affected the city in the past. And public health units are involved with the planning process and in support and response to such events. We also, of course, are heavily involved in infectious disease, communicable diseases, vaccine-preventable diseases, and so that takes you to, of course, pandemics, and the pandemic that we're just emerging from at this time. And there we have a heavy overlap with healthcare, but also, once again, with municipalities, and that this municipality, like many others, was very involved in many aspects of response to the pandemic. We do food safety, water safety, response to other health hazards, environmental health hazards, and working with young families for child and reproductive health. So many, many ways that we prevent disease for the population as a whole. And so, this image captures a sense of all of that, working in the community in all of those ways, including a lot of media work and a lot of engagement with other organizations and stakeholders. So we are emerging from the most severe pandemic of a century, of our lifetime. And certainly that's affected ourselves in Simcoe, Muskoka, with over 700 deaths that have occurred. And sadly, there are still deaths that are occurring from COVID-19, even though the World Health Organization on the 5th of May declared the emergency over. And in fact, we had more deaths occur in 2022 than the first 2 years of the pandemic. So the Omicron wave was by far the most severe and deadly, even though on a case-by-case basis it was less severe. It was so much more communicable. And even into this year, we were having between 2 to 11 deaths a week. It's only been in the past month or so that we've finally fallen off below that level. And finally, with our monitoring tool, have fallen down between what we call lower and moderate. We don't have a low rating. Lower is as low as it gets. So oscillating at that point between those two settings. In the pandemic response, we did many things. So surveillance and reporting of the kind of statistics that I've just cited. And in order to be able to do that, receiving case reports and responding to outbreaks. We had over 1,000 outbreaks in healthcare facilities, long-term care facilities, congregate settings over the course of the pandemic. And there were countless others, many of which we never knew of, that occurred in many work environments and other public settings. With partners and all of community approach, doubling our staff and having some 800 volunteers, and then the participation of hospitals and pharmacies, primary care and others. We vaccinated over 80% of the population and administered over 1.5 million doses of vaccine. And it's been estimated by the Chief Medical Officer of Health that without that kind of effort, we might have seen a 20-fold higher level of mortality or 13-fold higher level of hospitalization without all of the things that we all had to do together to respond to the pandemic. So as sad as it was to have those deaths, it would have been much, much higher without all that we did. And a lot of engagement, including with municipalities, as I'd already indicated. So we're in a recovery phase as a society and also as a health unit, and it's really, although we had hopes of, with a recovery plan of getting underway with that, even in 2021, it's really only been over the past year or so that we've been really able as a health unit to start to get back to our other programs and to start to get our staff deployed back from the COVID response. It's really been the beginning of this year that we've had them all come back to their program delivery. And so picking up on all of these programs is very much a part of our recovery, re-engaging with partner agencies, retraining of our staff for the positions that they had left, and allowing them time to do their own personal recovery, assessing all the way along how we've been doing as a health unit in the response to the pandemic, and now beginning to report on that to our partners as we plan again for events such as this to come, or even just the viral surge to come in the fall. And also doing some planning with regards to our financial needs as an agency. All of that is part of the recovery framework, and we will be taking to our board later this month a draft strategic plan for the board's consideration as well to supersede this recovery plan. So, among the programs that we've had to put effort into recovering is immunization. So we've always had Very high immunization rates of children in our population, young children, children in grade 7 and 8 for whom we provide vaccines right in schools. And that dropped off tremendously over the course of the pandemic, particularly with the closure of schools and our inability to be able to get to them in schools. And so it will take us the next year or more to be able to do that kind of catch up. We've been very active in the catch-up process in the first half of this year, but that is a high priority for us. The very last thing we'd want to see is outbreaks of vaccine-preventable diseases because of that lag in our ability to have covered the population. The opioid crisis continued, of course, and actually became worse through the course of the pandemic. There was, so much in the way of services in general in society that were held up through the course of the pandemic, and that had its impact in many ways, including on opioid mortality. And this occurred in the Western world, it occurred in Ontario, and it certainly occurred in Simcoe, Muskoka, and in Barrie. We did maintain human resources throughout the pandemic to continue responding to the opioid crisis, but that in itself was not enough to stop what we'd witnessed. We are starting to see some recovery, but the levels are still higher than they were before the beginning of the pandemic. And so since 2018, we've had an opioid plan as a district with partners, including municipalities, and we'll continue with that plan. It is a priority for the Board of Health to engage with our Indigenous communities, and through the course of the pandemic, we were successful in doing so, including with immunization. We're able to give special attention to our 4 First Nations communities, as well as the Indigenous population off reserve. And this is a photograph of us receiving some commemoration for this from the Memaway First Nations primary care service. And 2 of the individuals in this had made a presentation to the Ontario Public Health Conference in February of this year about our successes on that front. So we are accountable to our communities and put out an annual report. Most years, through the course of the pandemic, we had to put basically 2 years' worth into a single year, and made that available a year ago. And we're about to take to our board the 2022 annual report for the board's consideration and release later this month. So that'll be coming out shortly, but basically it provides an overview of the priorities for the year, the services that we provided. Certainly through the course of the pandemic, a lot of information about the response to the pandemic, but the financials are also provided as well. Should be one more coming. There we go. So we receive our funding from the province as well as from our municipalities. Under the Act, it's referred to as the obligated municipalities, upper tier, single tier municipalities. So Barrie is one of those, and about 30% of our funding comes from levies to our municipalities, the rest from the province. This provides the gross figures for the levies for the city of Barrie for the 3 most recent years, as well as the percentage increase, and expressed as on a per capita basis. You'll see that the actual per capita costing actually went down slightly in the most recent year. This is based on impact data, and so would be impacted on by population growth. So in closing, the Simcoe Muskoka District Health Unit is committed to working to achieve excellence in the delivery of public health programs and services. And municipalities greatly influence people's health. The services that you provide are critically important to the health of the population. COVID-19 has been the cause of the most severe pandemic of the century, and at this point in time, we are working hard to recover our full public health mandate. thank you very much for this opportunity to address you, and I'd be happy to take any comments or questions.
Thank you, Dr. Gardner and Vice Chair Ward, for your presentation this evening. Members of Council, are there any questions or all questions for the presenters this evening? Councilor Morales.
Thank you, Mayor Nuttall. Thank you, Dr. Gardner, and I was going to say Mayor, Councilor Warnock, sorry. Mr. Warnock, it feels weird. It's kind of a common question, but I actually found my old notes from the health unit, and I think everybody will appreciate this. It's kind of a time capsule. So this is the strategic report that we must have done in 2014-15, and it just goes to show how long-term planning always is at the core of what the health unit does. It says this: by December 2012, so this must have been the previous strategic plan, a scalable business continuity plan to systematically monitor and realign resources in order to respond to unanticipated public health issues that have the potential to disrupt programs and health for it to be developed by then. Wow. So, yeah, I'm sure that no one saw that coming in 2012, but that kind of speaks to the foresight that obviously the health unit has had. What do you see being the best thing that the city of Barrie can do, and just moving forward for public health? I know it's a broad question, but what I mean by that is the health unit was kind of, I don't want to say always an afterthought, but something people maybe took for granted, not necessarily the city, not necessarily residents, but just kind of society as a whole. And you guys became at the forefront of what we went through with COVID, and seeing your face on TV or the news every other day, it must have been exhausting. And I'm glad that in the presentation you said not just yourself but your staff as well. So, if you could tell politicians, and you have a crowd of them here, what would you say they can do to just make public health and better in general just a little bit easier to implement?
Thank you through your worship. Thank you, Councillor Morales, for your question. And your reflection was very interesting, actually. That particular reference came out of a previous pandemic, a much milder one, the H1N1 influenza pandemic of 2009, in which we didn't take into credit with our strat plan that things like that can happen. So therefore, we learned from the past, and hopefully that would be helpful for the future. And in fact, when I first arrived here in 2006, we did pandemic influenza planning and exercises. So we've been waiting a long time for severe pandemics to come. And looking ahead, I think, is critical. And you've asked, what can council do for public health? I would say you could answer that in two ways. One is to support the health unit. You support the health unit with the levy that you provide, and that is very much appreciated, and also with the membership and the governance and leadership that you provide through your councillors who are on our board. And I think that continuing to do that, of course, is of critical importance to us. At this point in time, we have uncertainty about our finances. We have uncertainty about the finances coming from the province. We may have some communication coming from our board in the near future related to that, and it would be shared with municipal councils for your consideration. So I guess that's a bit of a heads up on that. The other thing is that so much of what you do is important to the health of the population, and I would suggest always view your decisions from the point of view of how does it impact on the health and well-being of people, and in particular those who are most vulnerable, those who don't have the options that many other people have. What can you do to ensure accessibility to the programs that you offer or the services that are available in the community? There is a lot of planning that the city has done in that regard, such as your safety and security plan. It has a lot of good content in it. I would think that always referring back to that would be a wise thing to do.
Thank you, Dr. Gardner. Mayor Nuttall, he took my lackluster question and made it sound like it was worthwhile, so thank you, Dr. Gardner.
Thank you, Councilor Morales. Any other questions? Councilor Harvey.
Thank you, Mayor Nuttall, and thank you, Dr. Gardner and Mr. Warnock, and actually for your leadership through the pandemic. Obviously, as a board member. I had a front row seat watching how you maneuvered through a very interesting and difficult time to be able to get your staff to pivot to where they did and slowly pull them back into the places where they were supposed to be in the first place if we didn't have the big P happen to us. Because hopefully we can stop using that word, I hope, and we can get on with life as we once knew it. Moving forward, though, outside of obviously you just mentioned some uncertainty about budgetary in the future, what do you see as your biggest hurdle moving forward as a health unit to get us back to where we were, if not to even expand certain programs? Because I know as a board member we had to make some difficult choices at times because of financial constraints, and certain programs were paused or even having to be removed for a period of time.
Through you, Mr. Mayor, to Councillor Harvey, thank you very much for the question. You know, I think just allowing us time of stability would be helpful, and we really position to the province, we need a time of stability. We need a time in which there isn't a major change that is brought forward from the province on public health, on its structure, on its funding. We need the time of stability and certainty to be able to allow our staff to recover and allow all those connections to be reestablished with our other partners and to get our programs fully up and running. You know, I guess asking that there be minimal change would be the plea that I would have, rather than having perhaps in the year to come an abrupt change of some kind. You might recall in 2019 there was a call from the province to modernize public health and to change boundaries and to have mergers, and this health unit would have been heavily impacted by that, and that did not take place, and perhaps the timing of the pandemic played a role in that. And so I would reposition that we need a time of I would hope at least the next 2 years of stability to be able to fully recover.
Great, thank you. And I couldn't agree with you more that if there was one good thing that came out of the pandemic was the fact that the restructuring at the provincial level obviously was forced to pause, because I'm not sure that us merging with York Region was necessarily in the best interest of Simcoe County or our friends to the north in Muskoka. I think Mr. Warnock wants to add something to that.
If I could, as I said, I have worn both hats. I have worn the hat as a municipal representative when I was at the county of Simcoe, and now I'm a public member appointed by the province of Ontario. So I've been on both sides of every discussion. One thing that also came out of the pandemic and the recovery is the need to build capacity into the system. And it's right across the healthcare system. Whether it's primary care or public health, it's building capacity, because it has never been more clear or more painful, the lack of capacity in the system right now. We've all probably seen it, we've all experienced it, and the only way we can build increased capacity is with a stable financial situation. Because you mentioned, Councillor Harvey, and you're very correct, we had some very, very difficult decisions to make as a board over the last couple of years. Without the province fully stepping up or increasing the amount of funding we receive, we were going to have those difficult conversations again. And at the end of the day, it's the general public that suffers. Because you take it out of the system, you have a darn hard time getting it back in.
Great, thank you.
Thank you, Councillor Hart. Councillor Kunkel.
Thank you, Mayor Nuttall. So it's funny to be on the other side. So I'll keep my municipal hat on for my questions. But again, thank you for coming here. And I do appreciate that the board is making an effort to kind of connect with obligated municipalities. And I think it's good for the public on evenings like tonight to understand, why sometimes we don't hear from public health at budget sessions when we also hear from service providers, and that there is a really formal structure of funding that is required between provincial and municipal, and what that means. So I appreciate the time around engaging municipalities. The other piece, just in reflection around, I think, carrying on the conversation with Councillor Harvey around, protecting capacity. And I also think in my own reflection as a councillor through the pandemic is not just, protecting capacity, but maintaining it. And so, how do we, think about public health as an essential service, and what could that look like in the future around our ability to be responsive in our communities. And so hoping to see, and for those that are not aware, I think the public health conference is happening next week, and then the timing in general is good as we look at AMO, the Association of Municipalities of Ontario conference in August, and carrying on conversations coming out of the pandemic about the current state and the future state. I did have a question about some of the recent events, if you could speak to it while you've got the podium, because in addition to the programs that you covered high level, but also kind of the public health messaging and responsiveness, and with the air quality concerns, and I know the health unit put out within the last 24 to 48 hours a bit of a media advisory. Many residents have been asking me directly about information, and so it's good to be able to point back as a municipality to public health. Is there anything at this time to kind of highlight to the public around what we are feeling, smelling, and seeing around air quality, and just any good public health safety reminders?
Through you, Mr. Mayor, to Councillor Klungel, thank you very much for that question. And I would say that perhaps we're slightly shocked. It's one thing to sort of see in the media that there's something happening out west, in Alberta, British Columbia, or then in Nova Scotia, but then to have it on your doorstep, it makes it feel close to home. Indeed, we are experiencing adverse air quality at this time, right here in our own community. And for that matter, over a great swath of Canada and the United States, New York City, I noted in the media as well. So a huge number of people right now being affected by the forest fires and their impact on air quality. And the Environment Canada reading for today here in this city was of a moderate impact, but forecasted to go to a high level of severity over the next couple of days. Already you can sense it by going outdoors, and so I am concerned what that would be like tomorrow or the next day if it becomes that much worse. We do know that with poor air quality, everybody's health is put at risk, but particularly people who are vulnerable, people who are older or very young, or those who have pre-existing medical conditions, respiratory conditions, heart condition. And the advice right now is to reduce your exposure to the outdoor air. That's difficult to do, of course, since we are obliged to go out, and for that matter, the outdoor air gets inside for that matter. So it's going to have an impact, right? We have a limited ability to reduce our exposure to that. It's really otherwise hard to advise what further people can do. The Center for Disease Control actually advised the option of using an N95 mask for outdoor exposure for prolonged periods of time. So that's on our website. I'm not sure how many people would want to do that, but that would be one way of reducing your exposure to particulates as part of the issue with air pollution. The other thing we're doing as a health unit, in addition to monitoring and communicating, is monitoring emergency department visits. So we have a system with our hospitals whereby we get data on an ongoing basis of emergency department visits cataloged by type of visit, and we've already started to see, as of yesterday, a rise in people showing up with respiratory symptomatology in our emergency departments. It's starting to have a measurable impact. So It's important for people to be aware. We raise awareness and for people to know what they can do, but I think it's actually limited what people can do.
Thank you very much, and happy Bike and Seniors Month, knowing the programs that you do to support both. So it's a pleasure to serve with you and also to be a resident in a community by which your leadership has shone, and I deeply respect that and appreciate it. Thank you, Vice Chair Scott Warnock, and have a good evening. Thank you.
Thanks.
Thank you, Councillor Kungl. Councillor Harris?
Thank you, Mayor Nuttall. Mr. Warnock, you mentioned the public suffering, and I can appreciate that. I was wondering from the perspective of children and youth, and if you can, maybe Dr. Gardner, what was the impact on children and youth from the pandemic? And I know immunization was one thing you mentioned, people not getting immunization. But what do you see as the primary impacts on children and youth, and what would be the primary kind of response or activities from the health unit moving forward?
Through the mayor to yourself, Councillor Harris, thank you for the question. In fact, for the most part, COVID-19 did not heavily impact on children directly. There was some impact for sure, particularly those that had pre-existing medical conditions, and there's some potential for them to have long COVID, but for the most part it was far less severe than adults, and in particular older adults. The greater impacts were really indirect impacts. So the impacts of the response, of the shutdown, of school shutdown, on their mental health and well-being, on their social connectedness, on their educational advancement, particularly those that might have had more difficulty learning remotely. I think it behooves us to continue to do what we can working with schools, school boards, to address the mental health needs that they're seeing now in schools. We do have programs in schools. We do connect and have staff placed to connect with the school boards, and we get good information from them about what they're seeing in schools. And they're having to deal a lot with children who are basically upset with the experience that they've had to come through, and ourselves and other agencies need to be prepared to support that response.
Thank you.
Thank you, Councillor Harris. Any other questions? Seeing none, I just have a couple of things. First of all, there was no binder, no book written on what to do with COVID. You certainly were tried to look ahead at what could come down the line, but you weren't able to pull something off the shelf and say, all right, here's what we do for the next 3 years, right? And so I often tell people I think I'm the luckiest politician in the world. I left office at late 2019 and came back in late 2022 and missed all of it. And I'm not jealous of anybody who was in power and in office in that time period, because it created a lot of difficult decisions, but also decision-making processes on what are the inputs in order to get the outputs. And so certainly recognize that, and thank you for the service over the past years, because I can't imagine the stress and efforts that were put in day and night, literally, to guide through what we will all remember a long time from now as a very difficult and tumultuous period. Having said that, there's two things I wanted to ask about. One is with regards to a slide that was on the presentation, and so I think the presentation says there's about 700 deaths through the pandemic, roughly, give or take. Probably ones we weren't able to necessarily classify 100% either. But there was also a slide that showed about the deaths related to the opioid crisis, but I think it showed that there was roughly 40 deaths per 100,000 people. Is that for Barrie? Is that for Simcoe County? Is that for Simcoe Muskoka?
So, Your Worship, it would be for all three. It would be for the province, for Simcoe Muskoka, and for Barrie. We had three lines superimposed on the same graph. So it's later on in the presentation if you wanted to get to the opioid slide. There you go. That's it. expressed as a rate per 100,000 over time. So you can see how it changes each year. You can see that in all three jurisdictions it went up through the pandemic, before the pandemic and through the pandemic. You can see also that we in Simcoe County, Simcoe Muskoka are higher than the province, and Barrie is higher still.
So to sort of round it out if I can, taking the scope of the slide, we're talking about roughly 60 deaths a year averaged out over the last 3 years with regards to opioids in the city of Barrie.
Yes, Your Worship.
Okay. And where it went up and then it started to come back down, do we know what the inputs are for that, and do we see it? What do we see right now? Are we seeing an increase over last year, something steady? I know we're only halfway through the year, or not even halfway through the year, but what are we seeing on the ground at the moment?
Your Worship, we are continuing to monitor it on a weekly basis with a bulletin internal that looks at toxicity and mortality in comparison with the past, basically seeing a continuation at quite a high level. So it's certainly not abruptly dropping and fluctuating, of course, as you would anticipate from week to week when you look at something from week to week.
So the expectation is this year would probably be somewhere around that average of 60?
I would hate, Your Worship, to, I'd rather get back to you with an accurate figure rather than off the top of my head.
And I didn't send this ahead of time, so I completely get that. If you can maybe, even in July, just say, hey, the first 6 months of the year, this is where we're at. Because obviously that's a huge piece. And, one thing I do want to highlight, because it was, I think, quite a shock for the county and for the city. And I think there's a piece here where we actually have the county, have the city, have the health unit all in one place at one time, where we did receive an 86% increase in our homelessness prevention, which would certainly not go directly to you, but play in around some of the programs and services that you're providing out in the community. And so my hope is that as that funding, I don't know what the health care and health sector funding is for necessarily your organization from the province, but hopefully as some of these dollars hit the ground, we can make sure there's a collaboration between everyone to ensure those dollars are best spent, most effectively spent, and most efficiently spent to help individuals who are experiencing homelessness, which obviously has a tie-in, not all the time, but some of the time, with the drug-related items we're seeing in the community. So thank you for your presentation this evening, and sincerely, I wish you all the best, and thank you for the work that you do.
Thank you, Your Worship.
Members of
and
Council, thank you.
Our second presentation this evening is concerning an update on the housing needs assessment and affordability strategy. I'd like to call upon Josh McLeod of N. Barrie Lyons Consulting to the podium to provide the presentation. And you have a team here tonight too with you?
I do, yes. I have a couple members of staff that we're working with, and my colleague Margot Hayward, who's been integral to the work so far.
Wonderful, thank you. Turn it over to you now.
Great, thank you. So my name is Josh McLeod. I'm an associate at N. Barrie Lyons Consultants. Our firm is sort of a real estate and development consulting firm. Our focus is primarily on housing, and we deal with the full breadth of housing. We work on assignments for market rate housing, affordable housing, student housing, seniors housing, pretty much everything. And we've got a mix of employees in our shop that have backgrounds in urban planning, in market analysis, and in land economics. So it really allows us to take a unique look at the housing market. So tonight I'm just going to I'm going to give us a quick overview of the project that we're working on right now. That'll include hopefully a brief summary of the housing needs assessment that we've recently completed. I'll talk about some next steps for us, and then we can get into any questions that any of you may have. So our project is really broken down into 3 different phases. We're towards the tail end of phase 1 right now. The big piece of that was really the housing needs assessment deliverable, which was looking at sort of what's going on in the market today, supply and demand conditions, really establishing current conditions and different housing gaps. Phase 2 is a little bit more the action and implementation plan, so we'll be coming up with strategies for the City of Barrie to take to tackle the affordable housing crisis, looking at why there are housing gaps, and we'll also be looking towards what else is being done elsewhere successfully or potentially unsuccessfully as part of our recommendations. And then phase 3 is really sort of bringing it all together, updating the actual formal affordable housing strategy document, and then bringing it back to you for final approval. So for our housing needs assessment summary, this is, as I said, it's supposed to be a brief summary. The report itself is about 65 pages. It is pretty dense. There's a lot of data in there. Hopefully, if you haven't had a chance to read it yet, you will at some point in the future. But we'll go over this as quickly as we can tonight. So as we're starting here, I just want to quickly outline some of the key findings. And I don't think that these are particularly groundbreaking. A lot of what these housing needs assessments do is really confirm some of the things that we already know with data, really putting hard numbers behind it, so that we can start coming up with solutions that specifically attack those issues. So the first one here, ownership and rental affordability, is very strained in Barrie. There are very few options for low and moderate incomes in particular. Housing costs are rising at a far greater rate than incomes. This is not something that's uncommon outside of Barrie. You know, it's not just Barrie where these issues are happening. Ownership housing is unaffordable for almost all households, including many households that would be categorized as higher income. And that's driving more people to the rental market. As we drive more people to the rental market, that obviously causes issues in what is already a constrained rental market, creating more unaffordable conditions, particularly for those low and moderate income households. And lastly, you know, this is really, we're working towards the idea that Barrie's going to have to be planning for and encouraging a greater and broader supply of housing moving forward, and that really we're finding that rental housing should be the highest priority moving forward relative to ownership housing. And part of that is that we find that renter households are far more likely to be in core housing needs, so they're living in unaffordable conditions. There's a significant shortage in rental housing, as we'll talk about in a couple slides. And renter households in general, on average, earn about half of what owner households do on an annual basis. So their options within the market are significantly more limited. So before I get into what's going on in the housing market, I just want to really quickly touch on why it's important to invest in affordable housing. We've kind of got 2 buckets on this slide. The first one is negative impacts on individual households themselves. So if a household is unable to access affordable housing, they have less money that can go towards other specific needs, other important needs, things like food, things like transportation, things like education, particularly for our children. Some households are forced to live in unsuitable or inadequate conditions, either in housing that's in need of significant repairs, maybe there's issues with the electrical or with the heating, or that are inadequate from the standpoint of, say there's a 3 or 4 person household and they're forced to live in a 1-bedroom apartment. That would be considered inadequate for them. Not being able to access affordable housing also has impacts on our health, both physical and mental. It has impacts on our relationships. If we're spending more time commuting long distances or working multiple jobs, we have less time to spend with our families and friends. And there's also evidence out there from studies that children who are living in homes that are unaffordable are more likely to have emotional and behavioral issues. And all of these things really lead back to a lack of stability for these households if they're unable to access something that's affordable to them based on their income. Outside of the impact on those individual households, this is also a really significant economic development issue, which we're seeing in a lot of different communities, and we've actually done work specifically on the economic development side of this in other communities. So it obviously impacts our ability to attract employees to our community if there's no affordable housing. And this is a wide range of jobs. I think sometimes we have a tendency to think of, your baristas and your retail workers, the ones who are working service jobs that are maybe not the highest earning, but really it's becoming an issue beyond that with jobs like nurses and teachers that are really integral to every single community. Beyond that, it has an impact on productivity. If you're commuting long distances, if you're working multiple jobs, employer retention is reduced. If you can't access affordable housing, you're more likely to look for jobs elsewhere. As I had mentioned, commute times can be increased. That increases transportation costs. It has environmental impacts. It has impacts on our infrastructure. And lastly, there's less local spending on goods and services if households are spending more than they can afford on their housing. So we've included this figure just to kind of really nail home the point here on that economic development side. On the left side of our figure in purple, we have the taller bar is the annual household income required to purchase the average condominium apartment in Barrie. So we're approaching $200,000 a year there. And the smaller purple bar is the household income required to rent the average condo apartment in Barrie. On our right side in blue bars, we have the 10 largest industries in Barrie and the estimated median incomes within those 10 industries. And as you can see, 9 of the 10 are below the line for that rental apartment, and they're all below the line for the purchase of a condo apartment. And frankly, quite significantly. So what this really shows us is the challenges, particularly for single persons when they're looking to access the housing market. It really shows that you do require dual incomes to access a lot of options within the market. And this is only looking at apartments, right? This isn't even considering low-rise housing or townhouses, single detached, semi-detached, where the gap is even wider than we can see on this figure here. So this is sort of the basis of our housing needs assessment. What we've done is we've taken StatsCan data and it's been split into deciles, income deciles, and I understand that not everyone necessarily understands what a decile is. It may be a new word, but essentially what it does is it takes all the households in Barrie and splits them into 10 even segments. So each of these deciles represents 10% of the population, and the income next to it essentially represents the top end of that 10%. So our first income decile, we see under all household incomes is just over $35,000 a year. So that household would be within the 10th percentile of incomes within Barrie. As we move up, say, into the 7th income decile, the income associated with that one would be the 70th percentile of incomes. So we have two tables here. One is for all households, one is for renters. We use the all households data to determine what is affordable from an ownership perspective. And the reason that we're not looking at just owners is the idea that renters should also be able to potentially access the ownership market at some point in the future, whereas the renter households are specifically used just for renters. On the right side of each table, we have information on affordability thresholds. Essentially what we've done is applied a 30% of gross income to each of the deciles to understand what their affordability threshold is from an ownership and rental perspective. Rental is a pretty straightforward calculation. It's just 30% of income divided by 12 months. The ownership one takes into a few other factors: interest rates, property taxes. Obviously, we know that interest rates are on the rise right now. Bank of Canada had another jump today, quarter point. So those are the things that are taken into account here. And I'll just point to moderate incomes, for example, on the ownership side. Each of those deciles are below $400,000, and I think that we probably all know that there's very few options within the market at numbers like that. So in the ownership market, we've done a pretty detailed survey of the recent market in Barrie on both the ownership and rental sides. So from an ownership perspective, we looked at both new, sale, and resale. I'll talk mostly about resale tonight since that's what most buyers are looking towards. Really, the supply of ownership housing is not meeting demand, and that's nowhere more clear than in our figure to the top right here, where you can see the benchmark prices for resale homes in Barrie over the past 15 years or so. And we can see that there's been quite a significant jump in the last few years, and particularly in the last 10 years. So over the past decade, the benchmark price in Barrie for a resale home is up over 170%. This is compared to incomes, which have increased at about 34% over the same period. That 172% includes the recent drop that you can see in this figure throughout 2022 and into early 2023 as the market adjusts to higher interest rates. So despite the drop, we're still at really a huge amount of growth over the past decade, and particularly over the past few years. That recent price decline, while some may think that that brings a little bit of more affordability to the market, we can see in our table to the bottom right here that it really does not. We've modeled for you the benchmark price at the peak of the market last year, which was $946,000, and the March 2023 average of $735,000. So we're looking at a difference of just over $200,000. And when we apply a higher interest rate against it, we're essentially coming out at an even number in terms of a mortgage rate. So despite the fact that prices have gone down $200,000, it is not more affordable for households out there today. And as I mentioned, the lack of affordability, it does push people to the rental market, which we'll see is already constrained. Just a couple more numbers for you. 20% of resales from the data set that we had for 2022 were above $1 million in Barrie last year. 54% were above $800,000, which is considered unaffordable even to the 9th income decile. And only 1% of resales were below $400,000 and affordable to moderate income deciles. And those units that were priced under $400,000 were primarily studio and one-bedroom condo apartments. There were a few low-rise homes that did trade at that number, but obviously those types of units work for some households, but they won't for couples with children or other families, larger households than just singles or couples without children. So we've put together some tables like this, which you'll see a few times tonight. This one's for ownership, and it breaks down on the left side the average prices for a variety of different housing types, both in the new sale market and the resale market. Above we have our 9 income deciles with their affordability numbers below them. And red on this table means that that the average price of each of those unit types is unaffordable. Green means that they are affordable. So looking at the ownership market, this is pretty grim. There's a lot of red on this table right here. Even that 9th income decile has very few options as of today in the ownership market. And again, this isn't to slag on Barrie. This is not a Barrie-centric issue. This is a regional issue, a provincial issue, a national issue. This is a trend that we're seeing basically everywhere. The rental housing market. So one thing that I think that we were surprised to see was that Barrie's rental market has only added 350 net new units to the purpose-built rental supply over the past 20 years. So I say net new. You've built more than 350, but other units have been pulled out either through demolition or conversion to condominium tenure. So that's really not really adding any. Barrie's at about 4,200 purpose-built units as of right now, which is only enough to house just under a quarter of your rental population. So more than 75% of renter households in Barrie are turning to the private market or the secondary market and renting from investors, let's say, or renting someone's basement apartment. And as important as that segment is to the housing market, it doesn't provide renters with the same security of tenure or on-site property management, those things, those benefits that come with the purpose-built rental market. Part of the reason for that lack of new development is just that condominium tenure buildings have become much more appealing for developers to build. It just makes a lot more sense financially to build them. It takes less equity. It's easier to get financing. They actually cost less. There's costs associated with rental buildings that condo developers do not have to deal with. And those are all problems that are really holding back purpose-built rental development all over the province. We're seeing that just like in the ownership market, rental rates are rising rapidly in Barrie. A lot of options are now over $2,000 a month, and just so everyone understands, $2,000 per month is considered affordable for a household that earns $80,000 or more per month. We've got some examples on the right side here of some average prices for a few different types of rental types. So you can see in a newer purpose-built rental, all of the unit types are averaging over $2,000. We get a little bit of relief in the older buildings. And then when we get into the secondary market, again, we're mostly above 2,000, particularly when we're into low-rise homes that are being leased out. Vacancy is tightening in Barrie, particularly over the past decade. 9 of the past 12 years has been below 3% vacancy. Typically 3 to 5% is considered balanced conditions, but I would say that we're firmly below balanced conditions at this point. And even if we were to reach, let's say 3 or 5%, when we're looking at a stock of 4,200 units, it really doesn't provide that much relief in the market. Renter households, it's also important to consider that they're really driving household growth in Barrie over the last 10 years. They've essentially accounted for the entire household growth in Barrie. Barrie's seen an actual decline in owner households over 10 years. That's a minimal one, but it is a decline, whereas renter households have grown by about 5,500 households over the past decade. And lastly, as I'd mentioned earlier, renter households are far more likely to be in core housing need than owners. So back to our green and red tables here. For the rental market, we can see that there is more green, but certainly it's dwindling, and it's primarily focused in our high income ranges into the 7th, 8th, and 9th deciles. Once we're into the moderate income and low income, certainly there are fewer and fewer options within the market, and the ones that are available tend to primarily be smaller unit types, which again aren't necessarily suitable for, say, a family. What we don't have on here is private rooms. We did receive some data recently from Georgian College, actually, who's been doing some work on this, and they found that private rooms average about $1,000 a month in Barrie now, which gets us into affordability for, into our 3rd decile there, but certainly is still out of reach for our lowest income households. Lastly, I just want to touch on just community housing. Barrie's got about 1,265 rent geared to income units. It also has just over 1,000 new affordable housing units, which are a mix of secondary suites that have restrictions on the rent that can be charged. It also includes rent supplements and more typical standard affordable ownership or affordable rental units. These units have been created over the past 10 years or so, 8 to 10 years, and Barrie's actually done a great job in terms of exceeding the target that was set by Simcoe County in 2014, and has passed it by quite a bit in advance of the 2024 target deadline. That being said, as great as it is that the city has been able to pass that number, I think it's pretty obvious that things have never been more unaffordable, which can be a bit of a danger of setting a specific target of units, right? There are perhaps other ways that we'll need to be looking at that beyond just a specific number of units needed. And lastly here, more than 60% of the wait list in Simcoe County for affordable housing is within Barrie. It's closing in on 3,000 households, and obviously that's the largest wait list within the county. So our last one of these tables, and maybe this is obvious that these types of housing serve more of our income deciles, but I think it is important to point out that as the city is able to secure more of this affordable housing, it is truly effective. On the left side, we have a few different levels of affordability. 100% AMR is 100% of CMHC's average market rent, which, if you're doing something like inclusionary zoning, that's typically the level at which the affordable housing is provided. and 100% AMR starts allowing us to chip away at those moderate income households. And then as we move down into deeper affordability, 80%, 60%, we're able to start serving some of those lower income households in the lower income deciles there. So I mentioned core housing need a couple times. Core housing need basically takes into account three factors. One is affordability, adequacy of the housing. So adequacy, as I mentioned, is it in need of significant repairs or not? And suitability, which is does the housing match up with the household size? So 35% of renters in Barrie as of 2016 were in core housing need, and 9% of owners. The number of renters obviously far exceeds the number of households here. We've got over 5,000 renter households who were in core housing need in 2016 compared to just over 3,000 owners, which is still quite a big number. I'm using 2016 data here just because we don't have full 2021 data yet. I will also say that the 2021 data is a little bit suppressed. We've seen the core housing need numbers actually come down all across the country, simply because of the quirks of the 2021 census being based on 2020 incomes, which are inflated by a lot of the federal income supports that we saw throughout COVID. So those income supports temporarily drew a lot of households out of core housing need, at least for that year. So we'll see a bit of a drop, but I'm not sure that it's indicative of a future trend. These
Mr.
households
McLeod,
that are in core housing
Mr.
need,
McLeod?
they spend...
Sorry, sir.
Sure.
We're about double the time that we've
I'm sorry.
allotted for
Okay,
tonight.
I've
And
got one more slide after this one.
I
Yeah,
want
that's just
members
next
of council to be able to ask questions,
Yep.
and I certainly want to allow the County of Simcoe, who's here this evening, to be able to do that, and then have members ask them as well. So,
Sure.
see the next slide is into the next steps. I think
Just
that's in the
next steps, yeah.
report.
Yeah.
So why don't we move right into the question portion
Sure.
at this point?
Yeah.
And we can go from there. So there are questions from members of council regarding the presentation this evening. So I'll start with Councillor Courser, then we'll slide around the north end.
Thank you. Through you, Mayor Nuttall. You threw a lot of numbers and information at us, and for those viewing from home, how much does a single parent have to make to keep a roof over their head in the city of Barrie at this point?
Great question. I mean, we haven't looked at single parents specifically. It's just households in general, right?
I'm just throwing out like a two-bedroom.
Right. So we've got to assume you're probably looking at $2,000 a month at this point in the rental market, even for an older purpose-built rental building, which would mean about $80,000 a year.
So a single parent would have to make $80,000 a year not to be homeless in our city?
Oh, I wouldn't say not to be homeless, but in order to sort of fall within the definition of living within affordable housing, if we're looking at it as 30% of income, it would be $80,000. Certainly, there's a lot of people who are spending a lot more than 30%, which that core housing need slide showed that households in core housing need average about 50% of their income on housing.
Okay, so, and a follow-up question. The wait list for affordable housing within the city of Barrie is 2,996, that's rounded to 3,000, deep.
Yep.
Is that families or individuals?
That would be both. That would just be households.
That would just be households.
Yeah. That's a number that we've received from the county.
Okay, so those are the amount of households needed in affordable households that are needed for people. That's the wait list.
That is the wait list. I wouldn't say that that's the number of units needed. The number of units needed
Yes.
would probably be higher,
Yes.
right? It's just the households who have taken the time to put themselves on the list for affordable housing within Simcoe County.
Okay. Thank you.
Councillor Kungle.
Thank you. Through you, Mayor Nuttall. Thank you for the presentation. And for the public watching tonight, too, I mean, I just want to point that there is quite an exceptional amount of information in the circulation list tied to this. So thank you for bringing that forward in a very nicely laid out and concise way. a couple pieces come to mind, and maybe they're more about next steps.
Sure.
So I was speaking with Georgian College not that long ago and recalled a couple years back, just before COVID hit, they were talking about the home share program. And so does that fall under conversations and next steps about potential opportunities or leveraging programs like that would come back in later in the year?
I can't speak specifically to the home share program. I think I do know what it is, but we will be discussing the impacts of students on the market.
Okay.
As Georgian College grows their enrollment, that obviously adds pressure, particularly given that we know that a lot of our post-secondary institutions are increasing their international student enrollment, right? So these aren't domestic students that can just go home to their parents' home at night. So they do need to rent something somewhere in the market, whether it's a room or an actual apartment itself. So that is an additional pressure, and we have a little bit of information in our housing needs assessment on that, and how non-permanent residents have become a bigger part of the recent population growth in Barrie, and a lot of those people are those international students that are going to Georgian College, and that they will be factoring in a bigger way than they did, 5 years ago, and certainly 10 years ago, when our post-secondary institutions were more reliant on just domestic students.
Okay. When I look at some of your comment about the Bank of Canada raising interest rates by another quarter point today, and while the data I believe you presented was the census availability data, are we starting to look at forecasting out? So I look at the information, and although we talk about, and I love the layout by decile around affordability, I think that helps to give us a bit of a different picture and understanding pressure points, and what we mean by affordability, but also attainability. And so I thank you for bringing, I think, those balancing points around what the market is like in Barrie for us right now, regardless of income, and just competition for housing and adequate housing to meet one's particular needs. Is there any available data that would supplement this in time, or that would come back through next steps? So if I think about, what's the threshold? Especially when we're talking about individuals that have locked in at a 5-year mortgage at a very low interest rate, and when those start coming up, their ability to renegotiate or actually retain housing. And so I don't know where that picture might play a role in kind of current state census and affordability, because it's meek. But then what's coming? And so while we talk a bit about future recommendations that will come back as next steps, will that type of lens be put towards urgency to say, this is what we know about stock and affordability at that point in time, which is dated, but that's good data. But what are we actually forecasting around? I would say, is there a crisis coming for individuals in the low to mid income who are renters, who are going to see, people saying, I want to get out of the rental business as a landlord, and those houses coming up, but also then not actually being able to maintain a mortgage that they came into with, opening up a mortgage, their just term of a mortgage.
Right, yeah, it's not something that we've discussed yet internally, that specific topic. It certainly is going to be a pressure point nationally, I would say, just because the borrowing environment has changed so much over the past 12 months relative to what we were seeing for a couple of years there. It's something that we should probably be taking into consideration in our next steps, whether it's something that the city of Barrie can specifically deal with within the scope of sort of what your responsibilities are on housing. How we're envisioning the next steps is really taking a targeted approach at, here's exactly what Barrie can do, here are steps that you can take next week, here are steps that you can take in the midterm, here's are steps you can take in the long term, and then there's also going to be a bucket of advocacy steps where we recognize that you can't do this alone. It's extremely expensive to deal with the issue of affordable housing, or the lack of it, certainly to build it or to incent it. So we'll also be providing some sort of advocacy advice on how the city of Barrie can advocate towards the County of Simcoe, the Province of Ontario, and certainly the federal government as well, to start moving towards solutions to some of these things. So maybe that's something that falls within that advocacy bucket, as opposed to something specifically that the city of Barrie can tackle in terms of how to deal with things like borrowing costs and things like that, right?
Right.
Or
I think it just
mortgage, like re-upping a mortgage, right?
Yeah, so I think it's helpful around like bringing this to light, but also then if we know what's coming, does it enhance a pressure point about where we might need to focus our interests or prioritize particular types of housing?
Yeah, it's certainly a thought in terms of, especially in the rental market, what it could do, right? As you said, someone may come up to renew their mortgage and they can't afford the higher interest rate. So now they're moving into the rental market potentially. And as we can see, it's already a very tight market. So how are we going to deal with that, with the clock ticking towards 2 or 3 years from now, to ensure that we have some more supply in the market to deal with these additional households entering that, right?
Yeah, thank you. I appreciate it. And well, I absolutely don't expect you to have all the answers.
Yeah.
I mean, you've put us on a really great foundation of having great information to kind of move forward with dialogue and strategy.
Yeah.
So I appreciate the work you've put into this and the way in which you've provided the information forward. But I think that'll be a big piece, which is what are those environmental factors that, are not within us to control necessarily, but will impact definitely the conversations we have. And then where does MPAC sit in the future state of that whole process piece?
Yeah. If they come up with renewals from MPAC as well, that's another pressure point.
But thank you.
Councillor Riva.
Thank you, Mr. Mayor. And in view of the time, two quick questions. And I'm really interested that the three presentations that we have tonight have a real interrelationship. I attended one of the forums, and somebody, I don't think it was you, but it may have been, somebody made a statement that really hit me, and I wrote it down, and it says, the person said, there is no business case for affordable housing in the market. And what we're talking about here, one of the things we're talking about is affordability. And if there's no business case in the market to create affordable housing, where do we go?
It's a great question, and I'm guessing that the statement came from my colleague Matt Bennett. I believe he was on a panel that night. Yeah. At the end of the day, when we're talking about market housing, it's being built by a private company, and the goal of that private company is to make a profit on whatever service they're providing, right? Affordable housing doesn't provide them with that profit. So they need some sort of incentive in order to build it, right? Traditionally, affordable housing was handled by our various levels of government, and we've moved away from that model of investment. So where do we go? We will be unpacking that as part of phase 2. I know that that's a bit of a cop-out, but certainly there's incentives that can be provided to the private market, whether that's something like a DC waiver or, on the rental side, is it property tax relief? Is it advocating to the federal government for getting rid of the HST requirement that is on purpose-built rental housing development? Is it using public land in order to get more affordable housing built, right? Really, it's about trading off cost for that private market entity, the developer, in exchange for cheaper housing, for more affordable housing. Because that's really the only way that it makes sense for them to engage in building housing that costs less for the consumer, right? That costs less and provides them with the return that they require to then turn around and build more housing, right? We can't, it's like any business, right? We can't go into a clothing store and say, hey, your t-shirts should be cheaper, or a restaurant and say, your entree is too expensive, it should be $10, not $25, right? At $10, the business model no longer makes sense, right? So we'll be unpacking a lot of that in our next phase. I hope that answered it for you, or as well as I can for now, yeah.
Well, I'm definitely looking forward to your next report. The other question that I have for you is probably, I'm going to get the same answer, I'm afraid. You say that we need to create a lot more rental opportunities for people. The challenge is that as a city council, we don't have any control over whether it's rental or ownership. So what's your suggestion there?
Again, the more detailed suggestions will come later, but you could provide, so we talked about financial incentives, for example. One of those would be development charge waivers, and I understand that there already is some reductions or waivers through Bill 23 that the province passed recently, but you could provide those waivers specifically for rental and not for condo tenure. You could use your public land specifically to get rental housing built as opposed to condo tenure housing. You could provide density bonusing for rental as opposed to condo tenure. If someone's expecting that they can build a 10-story building, perhaps you say, you know what, you can build 15 stories here if you build rental. But you have to stick to 10 if it's condo, right? Those are the types of things that you can approach from Barrie's perspective, I think, to try to encourage more rental housing. But there will also be an advocacy end to that, and frankly, the HST issue, which I mentioned earlier, is going to be the biggest part of that. And that would be, advocating to the federal government on that. And I know that sounds, daunting from the perspective of the city of Barrie, right? But I think this is something that we're going to be encouraging all of our public sector clients that we're doing this type of work for. And certainly it's starting to get a lot more traction within the industry and even within the media about the issue that these cause, because it's a major cost for developers of rental housing, and it's a major reason why they're choosing to shy away from it.
Thank you very much. I think we're going to have a lot more discussion about this, but I appreciate the work you've done. Thanks.
Thank you.
Thank you, Councillor Rittman. Councillor Harvey.
Thank you, Mayor Nuttall. Thank you for your presentation. I knew it was a glum situation. You painted even a glummer situation, to be quite honest with you. And obviously, our younger generation and our kids and stuff are in one heck of a predicament that we weren't in 20, 30 years ago when we were buying our homes. Moving forward, though, I'm not one to sit and talk, and because I'll be quite honest with you, unfortunately, levels of government I find talk too much, and we need more action. Do you see moving forward more government housing as a solution and more co-op style housing as a solution, the way that we saw it back in the 70s, let's say? However, obviously government shied away from that model for some reason. But do you see that as a quick solution moving forward, opposed to talking about this for the next 3 to 5 years?
Yeah, it probably depends on your definition of quick, right? I would say that it's part of the puzzle. It's certainly not the only option to get us there. There's no silver bullet here. If there was, I wouldn't be standing in front of you. You'd already be doing whatever that specific approach was. Certainly the government getting more involved than they have been over the past 2 or 3 decades will be a key part of that, but there's a significant cost associated with that. It costs a lot of money to build housing. It's very expensive. It's risky. It's time consuming. So we get back to quick. It's not something that you can just do overnight, even if, as council and the planning department is fast tracking a development application, it's going to take multiple years to build that housing, right? So it's not something that we can just do overnight, but certainly that will be part of the puzzle. It will be something that we'll be suggesting, but again, there's a cost associated with it. We recognize the challenges associated with municipal budgeting. It's not something that, again, Barrie is going to be able to tackle on their own. The issue of government-built or government-funded housing. It's just too high of a price tag. I'm guessing that you just will not be able to fit it within your budget, and that's where, again, we get back into the advocacy part of that. So we're hoping to give you sort of, ideally a long list of action items, as I mentioned, that will be sort of split into near-term, mid-term, long-term, so that you can get moving as fast as possible. But this is going to be, this is going to be a longer-term process. right? It's not something that we can solve overnight. It's not something that's going to be solved quickly, unfortunately, just because of the nature of housing development, and getting new supply in the market is going to take quite a long time, regardless of what the price of that housing supply is.
Yeah, thank you. Yeah, no, I can appreciate that, and obviously, I'll be quite honest with you, us as a municipality at not collecting 9 cents on the dollar in tax funds, we don't have the ability to do it, and that's where the higher levels of government, provincial and federal, need to be paying attention to this, because this isn't just a Barrie situation.
Yeah.
This is an Ontario and Canada situation, and
Absolutely, yeah.
like, I mean, there's nothing more fundamental than having a roof over your head, especially when you think people are making 60, 80 grand and they can't even afford to put a roof over their head in situations, or they just can't find something due to the lack of housing. But I'll keep my comments at that, and thank you for the very detailed report, and I hope some higher levels of government are listening to this tonight, because we need some action, and I'm just tired of government at all levels talking about things far too much and not enough action. So thank you.
Yeah, and I'll add one thing to that. Just when we talk about advocacy, that's not going to be me telling you, hey, you should go talk to the provincial government and say, build us more affordable housing. We'll try to make that as targeted as possible, so that you're going to them with solutions and saying, here are some things that you can implement specifically that will help us here in Barrie and help us, elsewhere within the region and within Ontario, so that it's maybe a little bit more organized advocacy on the city's part whenever they come together to do any of that. And ideally, it's with other municipalities as well, and so that everybody's sort of rowing in the same direction on this issue, because frankly, if everyone's not involved, it's not going to work, right? Like, if York Region's not heading in the same direction as you on these policies and these approaches, then it's not going to bring affordability to Barrie. Right?
Yeah, you are spot on, and that's where AMO and associations like that come into play.
Right.
Thank you.
Councilor Morales.
Thank you, Mayor Nuttall. And I used to say to you, Mayor Nuttall, and anyone who would listen to me, that the Watson report for the infrastructure gap was the most important report that I've ever read in my 9 years on council. This is now the most important report I've ever read. Your presentation, spectacular. I looked up your firm just as you were getting up here and presenting. The work you guys have done in other cities, phenomenal, macro and micro, so kudos to that. And this report should be mandatory reading for anybody who attends a Planning Act meeting. I think, could we go to slide 14 for a second for our IT? The way I'm interpreting slide 14 is essentially social housing is now for the middle class. And I see some nods in the audience. Like, that is, most people are not going to take this hour to consume this doc and watch this meeting. So for the sound bites, social housing is now the middle class. It's not a very unique problem, but I just think a lot of us aren't able to capture the gravity of that. And something else that I took away from this is the people who are vulnerable, essentially. So millennials, for the most part. Gen Z hasn't quite entered buying homes yet. Millennials, single people, single parents, single seniors, or immigrants.
Yep.
If they make $40 an hour, which is roughly $80,000 a year, give or take, they are still unable to house themselves comfortably. That is just an incredible, an unimaginable reality. Specific question to you, though, is DCs. So you've mentioned it once or twice, so I'm going to connect this to a presentation we had a couple weeks ago. So we had a consultant just provide information that's gave a kind of a framework that we could adopt about increasing DCs. And without going, there's different categories, and I don't have it in front of me, but it almost saw roughly an 80 to 100% increase in most categories from the 2019 rates eventually into 2027. Not right away, but eventually if you follow that and if things happen the same. What do you see the impact of DCs, not just rental, but all units, purchased units, single detached homes with double garage, triple garage, townhomes, et cetera? What do you see DCs having an impact on affordability?
I assume you mean the like an increase to DCs.
Correct.
Yeah, I think anytime, it doesn't matter if it's DCs or anything else. We've had last couple of years we've had a big issue with hard construction costs increasing in particular. So that's your lumber or your concrete for new housing. So it's any type of cost, it's not just DCs. The developer will, to the best of their ability, pass that cost off to the consumer, but that only takes them to a certain point. There's always going to be a breaking point in terms of price. At some point, the cost becomes too high that buyers stay away. They look elsewhere, they look to a different community, they look to the rental market, whatever it may be. So there's two potential impacts. One is it can make housing more expensive if the developer is able to pass it off to the buyer or the renter. The other would be that it makes new development unfeasible financially, so you're not having new supply built. If it gets to a point where costs become too high and revenues are not high enough, and that developer cannot get a return or their desirable return, then they will stay away and they'll invest elsewhere. So those are two. I won't say that it's DCs specifically. DCs serve a purpose, right? Like obviously the city has infrastructure to pay for, they have services to pay for through DCs, and I would say that that's well placed. Growth should be paying for part of that, as should the existing residents. But yeah, those would be the two potential outcomes of raising costs in general too high for home builders.
Perfect, thank you so much. And Mayor Nuttall, I'll close it with this. May 24th in 2021, I had a second cousin of mine in Columbia. I think he's in his early 20s, message me and say, Sergio, things are getting rough here in Columbia. It's when there was a lot of issues with police and people. So 2 years ago. And he said, things are getting rough here. My girlfriend and I are thinking of moving to Canada, like you guys did. And he's just asking me options. Do you want to know what my response was? And I say this specifically to you. You just referred that you lived in Liverpool, and my parents immigrated with me in 1999, 2000. My response to him was, "Are you sure? It's cold, it's unaffordable," and I said this to him. I said, and coming to a culture shock once you're kind of past high school is a big commitment. I had to tell my own family member 2 years ago that the Canadian dream that my parents realized 23 years ago is no longer possible. The dream that your parents in the 90s, I believe, is no longer possible. That is a daunting reality, and that is not the making of this council, but we all have to work together, so that's not something that anyone needs to say.
Thank you, Councillor. Any other questions? Councillor Corser.
Through you, Mayor Nuttall, I hear a lot of conversation around the table about, or from the county, about approaching different levels of government. What about approaching community partners, nonprofits, and social enterprises within into creating that missing link if we're not getting the funding that we desperately need to cover the cost of affordable housing?
Yeah, we'll be certainly providing recommendations on partnerships that you can take to increase your supply of affordable housing. That will be part of our recommendations as well.
Because it just seems to me that it's like, I agree with Councillor Harvey, there's a lot of conversation around, how with numbers, data, all these things, but like the $80,000 a year for a single parent, as I mentioned before, is daunting, to say the least. We need something quicker than red tape and bureaucracy, quite frankly. We need something that is agile, that can move, that can actually make things happen. And I am hoping that it will be within government funding, but I think we need something a little action-based than that.
Yeah, that we're hoping that it is action-based, yeah.
Thank you.
And specifically things that the city of Barrie can do.
Okay,
and part of it will be to speed up the development process. That will be part of it, is let's get it to the market as quickly as we possibly can, right?
All right, thank you very much, because we have a homelessness crisis that is well documented and well talked about, and we don't need to have more neighbors become homeless because of interest rates and lack of action on different levels of government. So,
right, agreed.
Thank you.
Seeing no other questions, I think Councillor Corser is perhaps a little bit more polished than I am on the subject right now, because while I can appreciate the data that's in front of us, I already knew that, quite frankly, and so did everybody else.
Yeah.
You talk to your neighbor, you talk to your family member, you talk to members of council. We know that there is a massive affordability crisis in the city, in the province, in the country. That there's a massive problem that needs to be fixed, and I've got to say that for me, and I don't mean disrespect to anybody, like the next time we have this presentation, it needs to be solutions. We've been elected for 7 months now, and all of these things were real with the day that we got elected, and they're still real now. Mm-hmm. And they're going to be real a month from now, and 2 months from now, and 3 months from now, and we probably still won't have 3 months from now the proposed solutions back. And I got to say, I don't feel like that's good enough for us, for our team. So we need to get cracking. Affordable housing is incredibly personal to members of this council, to all of us, and certainly there's 4 members who've experienced living in affordable housing around this table, and attainable housing, obviously, because I always differentiate between the two, is incredibly important. What I think that I've heard tonight is there's a big problem that requires big solutions, and I want to see what those solutions are. Mm-hmm. I really, really, really want to see what those solutions are, and I don't want it to be 2024. I want it to be 2023, so that we can understand what the budget impacts are for 2024. And I'm trying not to make this sound like a rebuke. I'm trying to make it sound like, hey, we need to move a little faster when it comes to this subject matter, because we're discussing it every single day in our community. Every single day.
Yep.
Especially today with the interest rate rises, as you said, sir.
Yes.
So,
yeah.
Thank you so much for your team's work, for your work, and we certainly look forward to the next step of this process.
Okay. Thank you.
I would like to call upon the County of Simcoe to come for their presentation this evening. Mina, how are you, sir?
Good evening, Mayor. Good evening, council members, and thank you for having us here. I will try, given the timing, to move through the presentation as quickly as possible. I suspect we'll have some similar questions and intersectionality between the last 2 presentations that are quite relevant to our presentation and our common goal between the county and the city of Barrie. So before I start on the 10-point plan, I just want to give you a quick 3-point context setting of how we got here today. 3 things happened in the last year or so that have put us in a position today to roll out this implementation strategy. The first thing was about a year ago, we undertook a shelter system review. And that review helped us formulate a series of recommendations that allowed us to understand better the needs of our current homelessness system, including our emergency shelter system. Concurrent to all that was happening, and that report came to our county council and to the committee of whole, which the city of Barrie participates in, and accepted that report. It was in April of this year. As Mayor Nuttall shared earlier, the Ministry of Municipal Affairs and Housing also announced our annual contribution to their homelessness prevention program, and the county, as the system service manager on behalf of the province, received an 86%, or the equivalent of $9.2 million. This is a year after we received incremental increases on our federal funding program, Reaching Home, that increased about 5 times, from $700,000 to $3.6 million throughout the pandemic. So between the 2 programs, as a system service manager, we believe we've been right-sized, meaning that Prior to those two increases, the county of Simcoe, based on its population, and as a system service manager, we serve both the two separated cities of Aurelia and Barrie, which puts our population on par with regions like the separated city of Hamilton, Ottawa, Waterloo region, and Niagara region, and a little bit larger than London, London's catchment. So given that comparator, having that 86% was very welcomed. It was very timely. It had it at the same time where we've had these recommendations to point us in the right direction on how to move the system and get better outcomes. And then the third thing we did to get us here today is we started to develop, and we're building a data strategy that will help inform our future decisions on investments like this. The data strategy is meant to be a public-facing tool that shows a dashboard similar to the dashboards and data that you've heard from both other presentations here, to show us not only how we're doing, but what we're trending in and if we're moving in the positive direction or not, and also to set some targets to hold us as a community accountable to two primary goals that these 10 points are trying to meet. The first primary goal being we want to end chronic homelessness, meaning bringing it down to a functional zero, where for every person that's entering into over 100 days of homelessness, someone is exiting. Right now at the current state, we have about 1,000 people on our by name list. These are people who have been assessed in and prioritized as experiencing homelessness in the county, of which 50% are from Barrie. And of that number of the 1,000, you're seeing right now that we're housing out of that by name list about 170 each year. And now we're seeing a trend of about 380 entering into the system. That's a 3-to-1 ratio. We want that ratio to be 1-to-1. So the goal here is to move from that target using these 10 approaches in a very short period of time to start moving us in the right direction. The second goal is prevent homelessness. That 400 number of people entering in, we want to get that down as low as possible by preventing it, by investing in our inflow into the system to prevent and divert people from experiencing homelessness who are on the cusp. The previous presentation shared that there's 5,000 people right now that are renting homes that are using more than 50% of their income to stay housed. One or two more events in life that could happen could result in them entering into our homelessness system. So that kind of tells us that we have to focus equally on prevention as well as housing outcomes for those who are already experiencing homelessness. So going to the 10 points, the first point is to make affordable housing more attainable to end homelessness, and thematically you've heard that tonight. We're introducing something we've never introduced before, an incredibly deep subsidy. This is a 600 to 800, and we will explore even extending it to 1,000 based on some of the data you've seen tonight, to apply it to people who are looking for housing that's 80% of AMR. So someone that's on Ontario Works or ODSP is probably going to receive between 300 and 400 in a shelter allowance to go towards their rent. This would add another 1,000 to that, so hopefully allowing them to access more affordability. The second part of this tool is we're making it portable. We're building on the Canada-Ontario housing benefit that was introduced through the National Housing Strategy. This is a benefit that provides mobility to people, allowing them to travel with their subsidy and not tying it to a unit or a particular community or building. This will allow people to go and enter into other communities to find or seek affordability and not leave them with limited options. The second point in the strategy is creating new supportive housing programs. We're going to get creative. As you hear, this is a picture of 20 Rows, which was a modular facility that we co-invested together, the county and the city of Barrie, and we have it right now on our future site for a new affordable housing development that also got approved this year. That being said, it was used as an overflow shelter during the winter months. In this past winter. So during the summer months, we don't want it to sit empty. We're going to activate it as a 20 to 25 unit supportive housing program with wraparound support and on-site case management. The idea here is to use that subsidy from point one with a supportive housing model to empty 20 to 25 beds from our shelter system off the by name list using medium to low acuity clients. So people who would most likely have an opportunity for housing outcome very quickly. And hopefully we're challenging ourselves as a system to try to get 25 people housed in less than 4 months. The idea here is to demonstrate that a facility like this, modular, quick quick to assemble, purchase, and deliver. I think that was all done with less than like 4 months timing. To have something like that placed permanently and offering more affordable housing in a faster way to develop or create it. Something like this will not only create more space in our shelter system, but better housing outcomes. So it's helping address our outflow in that 3-to-1 ratio that I raised. On this site, we're also, another approach to this is as well as looking at our community housing stock. You heard that in Barrie we have about 1,200 social housing units. It's slightly different. There's two areas of numbers that get combined here. Simcoe Housing Corporation has 360 units of rent geared to income, basically older provincial and federally developed stock that was downloaded in 2000 to the municipality, as well as there's 1,200 additional nonprofit and cooperative federally built housing and provincially built housing that also has RGI units. So in total, there's about 1,600 RGI units. What we want to do is take existing stock that we don't have to develop from scratch or develop from zero and implement more supportive services on site there so that we are doing two things: preventing people from falling out of the system and entering into homelessness, but also when there are vacancies, start using these deep subsidized units with on-site supports that will be engaging with our health sector. Like, again, you heard kind of some of the work that public health does, but also working with Ontario Health directly, as other municipalities have done with community housing, to create supportive housing on site that would work off our by name list. So this is a difference in a discretionary option that the service manager has to open up its community housing to not just people on the chronological wait list, but to start prioritizing people experiencing homelessness on specific sites. One of the two buildings we're looking to do this year will be in Barrie, and that would be about 30 additional supportive housing units. So if you take the 30 plus the 25 plus the Tiffin site that we opened up earlier this year, about 14, you're starting to see it start to come out of supportive housing that's focused on deep acuity or high needs clients on our by name list. So this is a second strategy we're doing concurrent to the deep subsidy. The third strategy we're doing is creating peace of mind. Something we heard in the review and in the recommendations. When they engage people experiencing homelessness, our outreach team has also shared this experience as well, that a lot of people are reluctant to enter into the shelter system or access services or access housing help resource centers because of the amount of items that they have with them that they're afraid to leave behind or leave in a separate place or can't enter the system because there's a limit of how many items you can bring inside with you. So on site, we're going to try to introduce this container and storage program. It comes out of Vancouver and Los Angeles and other places where it's a program that staffs storage sites and basically creates on-site storage, private places where you can store large items, has clutter coaching on site as well, help people go through their stuff periodically. It's open and programmed daily, so people can park their stuff, go and access services and come back and get it with peace of mind. We're doing this all across the county. We are introducing a program in Barrie, but we're also going to be introducing it in all of our shelter locations, also in South Simcoe, Midland, Orillia, and Collingwood. So this was our third approach. Fourth approach is improving safety and well-being, and if you've been walking around, you may have seen some of this take action. So we're introducing a different type of outreach program that focuses on the well-being and safety of all. It uses a humanistic approach along with security and safety efforts to engage people who are experiencing homelessness, build meaningful relationships with them, and start to help advise them on all the different options and services and opportunities available to them to help them connect to services more frequently. So this is something that we are working closely with the BIA and with the community and with our service partners and with our outreach teams. We're introducing this, we've introduced it in the city of Barrie, we're introducing it also in the city of Orillia and the city of Midland as well. And again, this is more of a clear need that we've heard, again, that was given to us through that review. The fifth approach is increasing housing availability in current programs. So there are a lot of supportive housing programs that we currently fund in our system and that have been frozen that offer light care, light wraparound support. Some of those programs, like the domiciliary care programs, have been provincially, we were asked in our first iteration of funding where we had less flexibility to move away from these programs as they're not the best or adequate housing. But as you saw from the last presentation, I think it's all hands on deck when it comes to the different types of affordability you can place. So we're investing in these, and here you're going to see about a 40% increase in the City of Barrie's stock on this one. And we're hoping, again, these are programs that already exist, that already have on-site care. It's us subsidizing beds in these programs and making them available to by name list clients experiencing homelessness. The sixth approach is creating easier ways to access the service. One of the key glaring areas of need is a coordinated central intake to access shelter beds in the shelter system. So we're creating a one number that all can call, outreach teams, BIA members, people of the general public, and give that number to people who are looking for a bed. And this is an after-hours service. So while intake may already have been complete, this service will look at that open data set that I mentioned earlier, would access our database and see how many open beds are available and place people. We'll be mobilizing transportation and outreach teams to be able to connect people across the county. So if there's 5 people turned away in Barrie and there's 7 open beds in Aurelia, those 5 people would access those beds for a few nights until they can get better settled in the community of their choice. But the idea here is we want to be efficient, and we want to run a system that brings the best possible maximized service of use at all times. And this is why open data is really important to us, because it helps the system see its interconnections and helps our partner agencies rely on each other to be able to solve local kind of intake problems that happen on a nightly basis. Right now, 211 does some of this work for us through some of the referral of services, like knowing where to access services, access food programs, food security shelters. All of those are meal programs throughout the week. We know by their call volume about 36 to 37% is from Barrie, and for people looking for services in Barrie, we suspect when we create this centralized point of intake, it should show us not only better data, but it will also show us the depth of need by geography. So we suspect this number will be a significant investment here in the City of Barrie. Enhancing our community shelter services and standards. So one main common thing we heard is that the under current funding per bed for our county is way out of whack. While we have an average number of beds per 100,000 compared to those municipalities I mentioned earlier, we're about middle of the line, not the smallest and not the highest. 44 is about the middle, which is a good number. The amount we fund per bed is significantly less as a service manager than other services, and that's because we were underfunded. We are averaging about $6,500 per year per bed. The provincial average is around $36,000 per year per bed, but that's because there's a couple of outliers that drive that number. Toronto delivers its own shelter system at a quite high funding rate because there are city staff operating that site. Those sites, but it's also York Region also does something similar. But if you extract those two, the average is about 20, we're around 65. So we'll be making a significant investment, and this is where the City of Barrie will probably see a large investment here. It's about, we're planning to put a 90% increase in services on those funding of those beds. Now, the point here is not to create more space, it's to create better service that allows people to engage in all of the services, including daytime services, which are not fully utilized or fully operationalized across our shelter system consistently. It's also to set a standard and a set of accountabilities with this funding. It's an expectation to be able to have better housing outcomes. Again, the first of those two goals is we expect to do better on our housing outcomes. We need to get to a 1-to-1 ratio, and we need to get more people exiting homelessness before they enter into chronic homelessness. So the difference here is we don't want to see anyone exceed 180 days. Right now, 30% of that by name list, so about 300 people right now, are past 180 days. And like I said, you're seeing more people enter chronic homelessness than people exiting the homelessness system. So we want to turn that ratio around, and we need to do it quickly. So this is one of those things where we did hear it clearly. When you take tours of the shelter systems, I've had the opportunity and privilege to serve in 3 different service manager areas, so I've seen a lot. of these services and a lot of how they're operated. There is a disparity in level of consistent service across the shelter system, and we want to make that better so that anyone experiencing homelessness accesses a bed, gets the exact same level of service and care at each of the sites. That's including brokered care like medical, community health teams starting to actually do consistent hours at the shelters. We've got our community paramedics at all of our shelters doing consistent hours already. So we'd like to start to layer that supportive service on site as well to the best of our ability. Increasing eviction prevention services. So this is some of our housing retention funding. So right now, per person we have an opportunity for someone who's facing an eviction to pay down their arrears, someone who's exiting homelessness that needs to have a first and last month deposit, be able to access this once every 18 months. If you're a single individual, it's $2,000, but also if you're a family, it's $2,000. So what we're doing here is we're increasing the family portion to $4,000, and we're decreasing the amount of time you can access it from, if you're in arrears, from 18 months to 12. And we're going to do a one-time increase for the next 18 months for those who are single individuals to access a $4,000 housing retention, again, to try to enhance and speed up the opportunity and lower those barriers to find affordable housing. So if you need more, as you saw, rental is very expensive. So if you had a first and last month at 80% of AMR, you need at least $2,000, and that number is going up. So we'll be adjusting that in a one-time basis until we can get that ratio right, and then we'll go back to a 2,000. But the 4,000 is a standing change that will stay permanently. And again, you'll see that right now about, I believe, 37% of the families accessing this program are from Barrie. So this is going to be hopefully a number that we can increase locally as more people access the program. Again, trying to prevent the inflow and increase the outflow. And then improving our shelter. So this is, I think, the 9th one, the shelter service system itself. So there's a lot of long backstanding capital repairs that need to be done to some of these sites. A lot of new systems that you can put in place, ramps, accessibility, lifts, things like that. So we're asking all of our shelter providers to put in an application for a grant to start to retrofit their space to see if we could better utilize some of it. And it's an up to $50,000 grant. It's we're hoping to get our timeline for most of this is between now and the end of the summer, and the goal is to be fully implemented before the beginning of the winter so that we're best equipped in the hardest time to be able to respond to the need. Lastly, finding new opportunities. We're carving out a piece of this money to do the thing that we still need to do, as you heard from the last. We need to create more affordable housing. So this is where we're constantly looking for opportunities to invest, whether it be in land acquisition, property acquisition, or put it towards possible modular developments, facility purchases, like the Rose Street modular facility. We're going to continue to do that and look at that. And then if those opportunities don't avail themselves, we have the flexibility to invest that holdback back into the other nine approaches to, again, intensify that service delivery. That's the part. Sorry, I tried to do it as fast as I can. I apologize. And sorry? All right, that's it. That's the 9, and that's the 10 points to the strategy. Again, with those 2 goals in mind, right? To try to end chronic homelessness by making it to a 1-to-1 ratio from intake to outtake, and the second is to again be trying to prevent as many of those possible entries into homelessness that might be on the horizon based on a lot of the statistics you've heard tonight. Any questions?
Thank you, Mina, for your presentation this evening, and you covered a lot. And a lot of solutions-based items, so thank you for that. I know that the county council, the county staff team, as well as the subcommittees are all pouring a lot of time and effort in, and certainly you and your department are pouring a ton of time and effort in at this moment. And before we go to questions, I just want to say that I'm really positive in my outlook on some of the changes that you're making here. And I hope that you have the successes that that you think you can achieve as a team, because it'll serve the city of Barrie, the county of Simcoe, really, really, really well. So thank you for the work, and hopefully the next update is showing us some revised numbers on those ratios that are inverse and you want to right size them. So we'll go to questions, and I'll start with Councillor Rietman and go from there.
Thank you, Mr. Mayor. And I think that one of the people that we ought to be thanking is the province for sending the county $9 million, because I think that's one of the things that we really need in order to get some of these things to happen. And I think also I need to thank the county, because I think your approach to what you're doing is something that is really, I think, going to bear fruit. I'd like to focus, and you've given us like a whole lot of things here, but I'd like to focus on the Rose Street property a minute. And I hear you saying that you're going to get 24 people housed there for the summer, and I think that's a really great idea, and I hate to see it standing empty. I guess my question is, I have a number of questions about it. First of all, what's going to happen to those 20 or 24 people when winter comes and this is going to, I assume, turn back into a shelter? And I guess the second part of that is next year there is going to be construction on that property, we hope, and then what happens to that facility that we have there now? And I guess the other part of that, and it's sort of related, I think, where is what are your plans for cooling for this summer and warming for this winter?
Through you, Mayor Nuttall. Thank you, Councillor Rietman, for the questions. So for the first question, our hope and goal is that all 25 get housed prior to the winter. For any reason, and you know, every case is different and every opportunity for housing is different, but in the case of that, our ultimate goal, as you saw with some of the other strategies, like looking into some of our other existing stock, we do not want to see anyone revert back to the shelter system that's in that program, because the fruitful work that's going to be done in the next few months, we don't want to regress from that. So the commitment for all those who participate is that they would not re-enter the shelter system unless they so choose, but certainly the goal is to have them all housed. For the second question with Rose Street itself, so the question is, the answer is unknown right now. As you heard in Approach 10, and that's why it's purposely there, we really need to find a final landing place for a facility like this. And the point of us doing it as an emergency shelter and a supportive housing is to demonstrate multiple use. So I like the flexibility in multiple use. It allows us to adjust to the needs. And with our data strategy that I'm very excited for, as it comes into play, it will kind of direct us to where the need is and what we can do with it. So there could be a hybrid model in place, or just housing, or just emergency shelter overflow. That being said, we're exploring and we hope to find something that makes sense, and it's based on the level of needs. So we'll continue to do that, and I'm hoping maybe in a few more months from now that can come to a realistic answer for everyone, because as you know, we're going to go shovels at the ground a year from now, maybe even less than that time, so we do need it to find a new space for it. The last question you asked was about
warming and cooling centers. Right,
the warming and cooling centers. So prior to coming, last time I was here, I shared our budget and our budget plan, and we still put in $100,000 for a warming center strategy. We're going to match that as well with cooling, and we had the opportunity to meet with staff here at the City of Barrie, and we'll be working together to kind of try to align those services so that it does match your homelessness plan that you had announced a few meetings ago as well. So we are looking, we'll be meeting with some sites and opportunities, but we'll have that in place as well. And again, don't forget that with the significant increase in shelter space, and we're expecting daytime programming to be fully operationalized across the system, including, which I didn't mention here, but it does impact the City of Barrie. We're investing in surrounding shelter systems in South Simcoe, and in North and West Simcoe. And the idea here, these were seasonal shelters that would end with the winter season. We're operationalizing them year-round. So now what you're not seeing is a migration after the season ends to the urban centers where services are still open. So we're hoping those approaches offer more daytime services, including cooling and warming, depending on the season. Okay, I think those are the three, right? Okay.
I'll give somebody else a turn.
Councillor Nixon.
Thank you very much for that presentation. I've seen a lot of 10-point presentations over the years, and normally, there's 6 or 7 that I kind of like, and 3 or 4 that are, filler. In this case, all 10 hit home, and congratulations. That's very positive. And I thank you and your staff for your work. And to echo Mayor Nuttall, we look forward to seeing these things implemented, as quickly as possible. I just got a couple of quick things about Rose Street. One, you answered one of the questions that we're a year away or so from shovels in the ground. When the building is up and operational, what is the percentage breakdown on the housing percentage of transitional versus permanent low income?
For the Rose Street development,
yes.
Through you, Mayor Nuttall, thank you for the question, Councillor Nixon. So the last time we presented to council and committee as a whole, we were going in there with one model, which was an affordable housing model with 2 options. One, a mixed income option to a certain level, and then a larger mixed income, all permanent, non-transitional housing. And we were challenged to come back with more. So we're preparing a secondary report. I believe the second committee meeting in July. And that will demonstrate 3 different options with the financial, business cases for each. Our intent is to intensify beyond the 176 that have been currently approved. Currently, there's 176 units approved. And it's a mix of income, but it's hard to nail down, but I'll break it down for you. There's 64 RGI units in there, the deepest subsidy, because we're replacing 64 units that we're divesting in order to raise revenue for this development. And these will be for larger families, multi-units. We are committed to another 38 units using provincial and federal funding pockets, which have to be 80% of AMR. And then the remainder is really up to our discretion. So this is where we're going to probably introduce more 80% AMR, 100% of AMR, and 120% of AMR. If you recall in the presentation, the one that had a lot of green, the AMRs are a lot less than the one that had a lot of red, right? So even 120% of AMR, don't quote me on this, is somewhere around the 1,200 range for a 1-bedroom, give or take, yeah? So that still puts it in the world of quote-unquote affordability from the presentation you saw. It's not market rent. So AMR, is average market rent. So it's average market rent based on the CMHC community-based standard that they set on an annual basis. So it's, to answer the first part of your question, it's non-transitional, so it's all permanent housing. The second part of your question is that it would be affordable at different levels of affordability, from incredibly deep to 80% to 100, 120. It is a sustainable building, and that's something I really like to emphasize, which is unique to this service manager, at least the ones I know of, and I've participated in developing housing. And it's sustainable operationally, meaning that there's a lot of upfront costs, so the price tag is quite high, but it pays for the next 50 years of operational costs, including major capital, including staffing and labor costs as well. So in 20 years, we're not coming here and saying, hey, we need to replace a roof, a window, balconies, etc. That's all built into the upfront cost to develop.
Thank you. And just one other comment, I guess, or I guess question. Several months ago, when the original Rose Street, shelter program was initiated, we heard from an awful lot of people in the neighborhood who weren't necessarily opposed to it as much as they were confused, had heard different pieces of information, and that seemed to be the biggest issue. And I know that there was some communication with the neighborhood, both through yourself and also through the city. And I just wonder, this time around, is there any new program, or are we doing anything different this time to make sure that everyone in the neighborhood knows what's coming and what to expect?
Through you, Mayor Nuttall, yes, we still got a little bit of work to do. We were meeting with our city counterparts, and there's a few pieces on the planning side of the planning exemption agreement that we'll have to update because of the change in purpose. And we did a bit of a door knocking approach. I think we'll do the same thing and explain it in maybe a fact sheet similar to like a one-pager that explains what the program is, the duration of it, who's being housed there. It is low to mid acuity, so it isn't your more complex client. It's clients that have really really quick housing outcomes in line for them. So yeah.
Very good. Thanks very much. Thank you. That's all I have.
Councillor Kungle.
Thank you, Mayor Nuttall, through you to GM Fayez Baguette. Did I say that right? Thank you. You took me on an emotional roller coaster, I have to be honest. Like, I held back clapping to wanting to physically get up and hug you. And it is emotional because I think these are long-standing conversations, and not to be critical in any way around what the county has brought forward in the past, but with funding comes opportunity. And what you presented, though, around what you're going to do with the funding is quite comprehensive and frankly quite impressive. And you've given me more hope than I've had in a long time around where we can actually see progress in this area around dignity for people, but also around, I think, with that just changes lives. And so I think that it's quite exciting what you're proposing forward. Let me know how I can help. And on that, I've got two questions. The first one, and I could have misinformation, but I wanted to know, with the housing retention funding, while there is more money available to individuals to help them kind of retain in an urgent situation, is there a timeline for access to that funding? And I could have missed it. I didn't know if in the past, if it wasn't really released within a day or two, did people still get evicted? And so has the cycle time to actually going through the process of requesting it and getting the dollars into the bank account where it needed to be, is that something that's been changed as well?
Through you, Mayor Nuttall, thank you for the question and comments. I would rely on our Ontario Works team who administrates the fund. There is a lag, but that lag, we've kind of learned some tools of the trade on how to release the funding in a way. So we're even front end granting to agencies supporting clients to allow them who might have like almost like through a voucher program where you pre-purchase the support. Like, so in this case it'd be a $2,000 voucher, have that agency have 15 of those on hand already prepaid so that they can release the funding. When we access the program, we pay ourselves back through that. So that way the person relying on the urgent need, whether it's like, you're at landlord-tenant board or facing an eviction, or the unit's only available for a day because 10 people are competing for it and all you need is your first and last. We've seen things like creative ways to make sure that that opportunity isn't lost or the diversion from homelessness isn't missed. So yeah.
Thank you. And my last question has more to do, I think, with the information you spoke to about the crisis and the wait list. And I was wondering, a lot of the resident conversations where I've been on the other end of a phone call with individuals saying, I've got a neighbor who's going to lose housing because it's sold, or whatever circumstance it is, are in kind of an urgent time frame. And it brought to light for me that I still get questions about, what's the City of Barrie's role as, setting rental rates or managing that, and not understanding the role between the city versus the county. And when I think a bit about what I assume to be more individuals who never would have thought they would be vulnerable from a housing perspective, might not know because they might not have ever sought out county services. so one was really, is there a broader conversation or communications approach to, this is the county and this is what we do and this is how you get connected and how we can support amplifying that information as municipal elected officials to help let people know it's there, because I feel like I'm hitting people at a crisis standpoint. And they don't know that there's a process piece. So my question really is, are you actually seeing more individuals around, I think that of the individuals on the wait list, are you seeing that they're coming in crisis, or that they have an awareness about, okay, I know my housing situation's changing in a month or two, I won't be able to afford a next step, and I've got a bit of a buffer before I'm really going to be experiencing greater vulnerability. So I didn't know how we can help around getting that information out, but then do people know that, there is a process, and are they using it?
Yeah. Through you, Mr. Mayor. So there's two lists. There's the by name list, which is specifically a prioritized assessment of every person experiencing homelessness, and it's prioritized based on the depth of need. It factors in priority groups like seniors, single household adults, Indigenous, LGBTQS, and others. That factors in and gives them a score of or a level of acuity. The higher the level, the higher you go on the list, right? The second list is your community housing wait list, which is a centralized wait list, and I believe that's what you're referring to. I would say the community housing wait list is underutilized significantly, even with the number being so high, and that's because a lot of people are detracted from it because of the prospects of actually having a housing outcome. The way the list works is we're the system service manager that creates any localized priority. Like we could localize a priority for 1 out of every 10 offers goes to someone experiencing homelessness. You can do things like that, other service managers do. But it's superseded by provincial priorities, and right now there's primarily one main priority, which is people experiencing fleeing domestic violence or domestic abuse and human trafficking. So any of those people will supersede any opportunity. So if you're number one on the list ready to get offered and someone is fleeing one of those violent situations, it goes to them first and not you. So even if you were experiencing homelessness and you're the number one on our localized priority. The second thing is, right now out of the 5,000, let's call it almost 5,000 people on that list, that's 5,000 separate households. Does it definitely define whether they're from our communities or not? And that's where our data and our publicly facing data will help show the pressure points of who's interested in living where. Right now, I think around 2,000, just slightly under, are looking to live in Barrie. There's only, like I said, about eligible off that wait list, about 1,400 RGI units between the nonprofit sector and the community housing owned and operated by the county that's available. And some of it could be seniors, so not everybody could apply for that, right? So we could definitely do a better job. One of the things we're doing is we're modernizing it so you can apply online, you can apply at kiosks. We're putting kiosks in all of our main community hub spaces that we're developing in all of our offices. It'll be integrated with your data and cross-referencing your databases like with Ontario Works databases and others, so we know who our common clients are. That will help. But certainly for the broader general public, like I do think we need to do a better job. And part of me doing these presentations in front of councils and meeting with all the board of directors of all of our service providers is try to deliver the same message on what our plan is and what our breadth of services are as a service manager. So we'll need to do a better job, yeah.
Thank you, and I'll say, even if there's anything that's easy or quick of hand that I can incorporate into all ward newsletter or town hall, that can also just point people in that direction, then I'm happy to include that in my communications.
We can develop stuff like that, yeah.
Thank you, Councillor Kungle. Councillor Hamilton? Oh, Councillor Corser, sorry. I was looking at you saying, okay.
Thank you very much, through you, Mayor Nuttall. Sorry, acronyms just kill me. AMR.
Through you, Mayor Nuttall, average market rent.
Okay, thank you very much. I just have, a lot of people say, like, why would you want to live rough instead of coming into a shelter? And I my research and everything I've done to try to figure that out has come down to the 3 Ps, I call it: partners, pets, and privacy. Now, understanding that this is a complicated issue. We all keep saying how complex this issue is, but it is. And going forward, like, people that come into the congregate shelter cannot stay with their partners. They cannot bring a animal, which, like dog, whatever it may be, with them. And I know that there's fostering systems out there. There's volunteers. I've heard of them. I haven't quite nailed any down. But when we look at this as privileged people who have roofs over our heads, we maybe don't understand the impact of taking away somebody's support animal. So they won't come to a shelter if they have to do that, even if it is going to foster. And the privacy issue, because it is congregate, so you're in an open space. And these people who are traumatized, victimized, all the things that happen when they do live rough. So will these three, and the storage of their belongings, which is really good to see that segment of it, that piece of the puzzle. But when somebody's living rough, they also have to pack up all their things, take it to a shelter, and then have it stored, and then drag it back to wherever they're going if they're staying for a night or two, and then re-find a place to actually live rough. So with them bringing into the channel of having supports to build them out of homelessness, like living rough homelessness, that's maybe something that would be, would maybe mitigate that, but at the same time, these are the issues that I'm hearing of why people don't. So is there any of this improvement of shelters, is this going to address any of the 3 Ps I referred to when congregate for partners, pets, and privacy?
Through you, Mayor Nuttall. Yeah, the short answer is yes. Like, that investment is to create a service standard. We're about to release a standard for all shelters of the level of service you receive and have it be consistent. Some shelters do accept pets, some don't, right? So we want to make it that. The second piece is matching suitability. So again, trying to get that standard right to define who's able to do what as a shelter provider. There are some shelters that have some strict guidelines by their national, syndicates, or by their own guidelines, their own core principles. So we want to make sure we understand what level of service is being offered to all types of acuity, from low acuity to high, and recalibrate that so that it meets the need. So that's why we're funding a service standard. That's why we're increasing funding to improve that level of service in the shelter system. I do want to flag, like, yeah, maybe your 4th P is property, right? Like,
Yeah.
But I think that assessment's pretty right. I also do want to there's some people who are battling addiction that don't want to enter into a congregate setting. There's some people who have never entered a shelter and won't.
Yes.
And that's why improving our street outreach and investing in street outreach was a significant part of this plan, because we want to mobilize support and actually put housing subsidies in the hands of street outreach workers to work on housing plans for people who are living rough, like in the example you gave. So
this might lead into my second question. The by name database, this sounds like a life or death type of database to me. So, and I understand that local shelters across Simcoe County, I understand it's across Ontario that this list is used. Is that true?
Through you, Mayor Nuttall. The by name list is a requirement of both our federal and provincial guidelines. It's a practice. It's asking communities who want to get additional funding, and we're one of the 63 nationally that participate as a community that has a by name list. You have to have a certified by name list in order to get this additional funding, but it's a best practice in how you approach ending or addressing homelessness. And the idea here is because you're prioritizing and matching the person who's in most need with the first available housing opportunity. So the by name list, to your point, is a critical tool. I think coordinated access is the second critical tool, and the third one is a centralized intake model. When we activate the centralized intake model, we'll have all 3 in place here at the county.
To further to that, so this by name database is such a crucial step to create this system that will hopefully help our crisis that we have. So I understand that shelters use the by name database. They enter guests into their clientele into that database. How, as an organization, because it's so crucial, is an organization that's been granted access to this database, how is that access granted? Does the county ensure that all users are trained on how to use that database? And I made some notes here. And how are they guaranteed they're implemented to ensure that it's extremely important is accurate, consistent, and unbiased? Because hopefully they're not true, but I've heard reports in the community. So how is that policed, if you will?
Great. Through you, Mayor Nuttall, great question. First, the by name list is a federal database called HIFIS. It stands for Homelessness Information Family and Individual Database or System. It's an acronym.
I'll run with the acronym.
But what it does is it has us reporting on a monthly basis automatically to the federal government, which then matches us as one of the 63 communities to see how we're doing to get to a functional zero. So it's a requirement of us, so therefore it's a requirement of all of our service providers. They enter into an agreement and sign a contract that's HIFIS-based that talks about all the information sharing, the privacy rights, the privacy laws and protections and practices. As a service manager, we're obligated to continuously offer training to all new employees, and we're expanding that training to even volunteers because a lot of shelters rely on after-hours volunteers, which is where we're not seeing live data being entered timely. And we want live, timely data, which will now be published publicly as a part of our dashboard so that we can be able to measure how we're doing night after night and not have a 2-day lag on understanding what happened 2 nights ago in the shelter. The second thing is we're funded to do it, so they're funded to do it. So from a compliance and accountability standpoint, this is something that will have a much more detailed fidelity in that data, including our mobilizing our staff teams and our to do some site visits and some checks and to put in some rigor in the system so that we know that we're maximizing. This isn't about being punitive or penalizing a really overstretched and underfunded set of providers. It's about making sure that we're utilizing every space we're funded to, because if we don't, like this money and these funds can be clawed back, can be reduced. So we want to protect that investment. And there's some good data around how to operate efficiently. Like if you're operating 1 bed per 1 person per 1 year, that's, like I said, like say it's around now the 15,000 range or something like that. Or you can operate that 1 bed for 4 people per 1 year. So now all of a sudden that bed becomes incredibly efficient use of that investment. So those are the kind of data points and targets we'll be setting prior to entering into these new agreements in order to have people have a goal to work towards and how the providers can be working on a common goal with a common set of targets.
Yeah, thank you. I'm a huge fan of data, and if you don't measure and you can't record, then you can't fix anything. So that's great news. Thank you very much.
Councillor Hamilton.
Thank you, and through you, and great questions, Councillor Curser. You took a couple, so I only have one left now. You've received a lot of praise tonight, and I will echo the praise felt by my colleagues here, and I know sitting on County Council, we've had some dialogue around this, and I really do appreciate the solution-focused presentation you provided tonight. I know previously data has been cited that 70% of the homeless population attribute being homeless to mental health and addiction issues. And I just wonder if you can talk a little bit more about the integration or partnership of mental health and addiction services within the shelter system. I know you talked about Rose Street and the wraparound services, but beyond Rose Street, because if we're truly going to address, I think, the root cause of chronic homelessness, like you said, right, we've got a 1-to-3 ratio right now, I think mental health and addictions is probably a good place to start. So I'm just wondering if you can elaborate a little bit on that.
Through you, Mayor Nuttall, thank you for the question. So a couple of things. We're trying to take an approach. So this is where being a service manager gets a little bit tricky because we're funded by one main provincial ministry that has a very defined boundary of where you enter into health services and not. What we're doing is taking an approach this year at AMO. I believe Deputy or Councillor Harvey mentioned AMO. We're going to be our campaign at AMO would be to meet with ministries to see how we can access crossover service funding. I know at other service municipalities, some of the larger ones, City of Toronto being one of them, received $48 million for on-site health and support care in their housing from the Ministry of Municipal Affairs and Housing. So I'd like to see if we could replicate that here. The second thing, to answer your question, so we're working with the established community health teams. So there are 4, I believe, in Simcoe County, the way the catchments are divided. So we're right now working with one in Aurelia to align health services, on-site care services consistently in that shelter. We're going to take that model and duplicate it not only in our shelter system and broker those agreements. And this is the tricky part. We need those healthcare teams to take on unattached clients. So with the development of Barrie, there's a real opportunity there to create a community hub space that delivers on-site care services. And by developing the space, we can get Health Ontario incentivized to creating another community health team in Barrie. And if we do that, we can then attach to that space incentive, like utilize this brand new functional space in exchange for obligating the taking on of unattached clientele. That will probably be one of the best underlying outcomes to have enforced. So we're still at early stages. We've set up standing meetings with Ontario Health to get us to that point of that outcome of getting those health services, not only in the shelters, but also in our affordable housing standpoints. And the pilot in one of the action items with community housing is doing that. We were able, when at the region of Waterloo, to garner direct funding from the local health integration network and put it in community housing to have mental health and education supports. We're hoping to do the same through a brokered partnership done by Ontario Health. So that's how we're going to turn that community into supportive housing with our GI subsidies attached. So working on it. It's going to come in drips and drabs because all 4 are different. Some of them are maxed out on taking on new clients. So this is like stretching those who exist pretty thin, but also hopefully incentivizing another community health team to be stood up in the Barrie area.
Perfectly answered. Thank you.
Well, thank you, Mina, for your presentation this evening, and certainly we look forward to working with you over the next little while on this. Absolutely love going through KPIs from government that isn't dollars spent, isn't dollars committed. It's focused on results, and so please don't lose that over time. And certainly looking forward to the results. That concludes our presentations for this evening.
That was the update from the City Hall. Thank you.